My second pregnancy, I nearly died and I lost a lot of blood. And my baby nearly died. It's a local obstetrician saved my life. Well, during that period, I clearly was anemic. I did lose a fair bit of blood. We are both doctors, and yet we had a level of not really understanding what was happening to us and overwhelmed by a lot of emotions, a new baby and all the changes that brings. And so you don't really think about iron deficiency at that time.
And this young woman, she'd come to the hospital already iron deficient and anemic because it hadn't been addressed. She had massive hemorrhage while she was delivering her baby. And we struggled for quite some time to get her bleeding under control. And unfortunately, she did end up having to have her uterus removed. But it sticks in my mind that had she been treated for iron deficiency properly, that we might have been able to preserve her uterus and allow her to have a second pregnancy.
Had we known her risk, we probably would have taken her to a different hospital, a hospital that had the ability to handle that type of emergency. So there was delay in her care because we didn't know. So these things really do impact outcomes and people's lives forever.
We received a lady who has just delivered. She has bled a lot. She came to us almost gasping. There were no recordable blood pressure, no pulse. Somehow things worked. We could really save her. She was anemic from just before even conceiving. She was anemic. And then she conceived, she had a baby. And then during the delivery, she bled a lot. I think when we first get an opportunity to meet a patient, we must try to understand what has been the history.
She bled up to having postpartum hemorrhage. She received blood transfusion, admitted in the ICU. She survived. Actually, when you had postpartum hemorrhage, it's a risk of having another one for the next pregnancy. But when she was coming for the next pregnancy, we prepared the materials, we prepared the medications, everything was prepared. We were able to deliver her safely. We did not transfuse. And that lady was able to hold her baby in a very few seconds. That was really a good history where, preparation can make huge difference.